However, last week, Wednesday, was World Oral Health Day. This Tuesday, we want to look at this year's theme, prioritizing oral health leads to better health overall. To achieve the foregoing, we will be having a dentist, Dr. Funmi, a friend of the house. She'll also be discussing how to prevent offensive odor, a major talk point from last week. Join us. Welcome.
Thank you.
Dr. Funmi in the building to the show. Good to have you. So you can call us on 081-0764-1679-090-241-63440. You can also tweet to us at TVC Connect. Please hashtag YourViewTVC so we can read the tweet. Good to have you.
Thank you for having me.
We know you've always been one of those dental advocates, oral hygiene advocate, and tell us about the theme of this year and what it's about and how you're implementing it.
Okay, so the theme of this year is focusing on how oral health influences the general health and well-being of a person, and so we're championing that and saying your mouth is an integral part of your body and you need to pay attention to your mouth. We shouldn't wait till we feel pain, till there's something amiss before we show up at the dentist. Just having your general checks regularly helps to prevent a lot of other systemic diseases with associated oral diseases, to Alzheimer's, to Parkinson's, to heart diseases and strokes. And so we want to care for ourselves holistically by starting with the mouth.
So there's this rave where everybody just wants to whiten their teeth, right? Not more about cleaning and polishing, but whitening, so that when you flash that smile, it's just popping, especially if you're dark skinned as well. And I've been asking questions about it. How healthy is it? Will it at some point begin to affect your gums or your teeth, the natural one that you've come with? And why should you opt for it, for those who are interested in having that, as against just polishing and cleaning your teeth?
Okay, so having your teeth whitened is a cosmetic procedure that we offer in dentistry. I always say that as long as it's a dentist offering this service within the recommended range of products that should be used, you are safe. But if you're meeting other people, you go to a spa, they know nothing about dentistry, about the recommended percentage of peroxide to be used, and you're burning your gums, you're getting inflamed gums and oral tissues, then there's a problem there. So you should make sure that it is a professional that is seeing you. There are many people that come in to me and ask for tooth whitening, and I say that is the last thing on the list that you need. You need to get your teeth cleaned, you need to get your gums in order, you need to get your whole oral health working, and then when you're there, then we can start going for cosmetic procedures. But we'll always go for oral health over just cosmetic.
So I'm really happy you highlighted this, because it's becoming really worrisome that estheticians, is that the word? Estheticians are offering teeth whitening, they are offering dental solutions, which shouldn't be. And many people with terrible oral conditions are now getting plastered on with white teeth that makes them feel like their oral hygiene is good, or their dental care is on point when it isn't. So I'm happy you highlighted that. But I also want to ask about the fact that there is, you mentioned in your introduction that people link our oral health is a way to trace some other systemic health conditions. So I had I was having gum infection. I was just like, there was pain in my gum, and I was trying to use mouthwash to deal with it, and I spoke to a doctor friend, and he said, no, you have a deficiency. Check your vitamin C level, check your vitamin D level. It was terrible. So, and just by increasing my multivitamins in terms of vitamin C and vitamin D, the mouth sore went on its own. So can you give us some other examples of other terrible health condition that the indication can come through oral, maybe some mouth pain or something?
Okay, so usually when a person has diabetes, one of the first places we can notice is in the mouth. Yes, many times when you have renal conditions, kidney issues, we can tell in the mouth. When there's a problem where you're going to have a heart attack, we can tell in the mouth.
Seriously?
Yes. So there are major blood vessels and nerves that go from your mouth to your body. When you have a lot of oral, you have a lot of deposits in your mouth, we can say that these plaques are directly going to your bloodstream, and it can further trigger heart conditions. And so it's saying it in the simplest terms possible. And so we always say that keep your mouth clean for a healthy body. when we say get your teeth cleaned every 6 months, it's not just because of the cosmetic reasons. It's because there's a whole lot happening. There's a mouth-body connection that is linked, and that we don't want to get in all those dirt and germs from your mouth into.
So if I came to your dentist, your practice now, and how would you be able to tell by looking at my mouth that, oh, I might have a kidney problem or a
diabetes?
Diabetic problem?
With diabetes, many times you have gum disease. You have your teeth begin to be mobile. We ask you, did you always have any problems? Or your teeth mobile? Did you just notice that you're having mobile teeth? Your mouth is there's higher mouth odor. It wasn't that way before. There's some characteristic smells of breath that we can tell, oh, this is a ketone related disease that's associated with diabetes. This is a smell that is associated with kidney condition. And so there are different smells, different conditions, different, the way your tongue appears, the way your oral mucosa looks, we can just tell what is happening. There's a lot of HIV diagnosis that happens also by looking into the mouth, and so your mouth is the mirror of your body.
Wow. Hearing that for the first time. Like almost 3 years. So I was going to talk about the tongue.
Yes.
Because when I was a kid, my second mom, my stepmom, when she wants to brush her teeth, she will like drag, and then we learned about the years that you're just supposed to be making it easy. So what's the best way to wash the tongue? Do you have to scrub it?
No. I like to say that take care of your mouth with tender love and affection, and so just a gentle cleansing action of your toothbrush will do the job. You don't need to scrub vigorously. That way you can enjoy your papillae. No, it will not smell. If you get the dirt in between your teeth out with floss, with your dental floss, and you just clean your tongue gently, you would be fine. Really, yeah.
I have children that have to brush their teeth every morning.
Yeah.
And I know that the days I'm just doing that gentle thing, by afternoon I'm asking, what's happening? Did you brush today? You know, till I scrub and scrub. So you're telling me now that I don't
the gentle action of cleaning from the back to the front will usually do the trick.
Yeah, she's talking about the tongue, not the teeth.
Yes.
She's talking about the tongue, not the teeth.
Yeah, the tongue now.
Because I was going to ask, like, my daughter, she doesn't gargle. Like, she doesn't rinse their mouths. She rinse it and leave the toothpaste. That's the new one that we have heard. Because when we were growing up, you must rinse your mouth and you must gargle. So, okay, since you don't rinse your mouth, can you do go? Can you gargle?
So the point of leaving it there to act is that there's some medication in toothpaste that when you leave it there, it has a longer term of action and can help prevent carious lesions. It can help supply calcium deposits linked with your saliva. It helps to reinforce the protection that your teeth have. So that's the mindset behind leaving it on. But you can rinse out if you want to. You can gargle and rinse out, but not too much, just so you have a little acting on there. Even the minty taste, the minty smell from the paste is still there when you leave it on there. So that's why we say keep it on a little bit more.
So culturally, we were used to rinsing out that entire thing. So I still do it in the morning, but at night I leave it because it helps with the gum. I want to ask you about children. Is it hereditary? Because sometimes I feel like I didn't have to do those terrible scrubbing of my tooth, and I do have so far, knock wood, good teeth. So, but with my kids, it's a struggle. They have plaque, and I don't usually have it the way they have it. So I'm like, I don't know. Is it like from a family, or is it something you eat that make you have that plaque build up?
So we have highly processed diets these days. From sugar, we're eating much more sugar than our ancestors did, and so all of that predisposes to higher plaque deposits because it's that action of your mouth interacting with sugar and all the things you're eating. There's so much bread we're eating. There's noodles is when you break it down, is sugar, flour, and also the nutrition and diet has a major factor to play in that regard.
So how often should your kids whiten their teeth?
No, they should just clean. They should get the dental cleaning done every 6 months. Everyone should do it.
Children even whiten?
No, they shouldn't whiten. We don't advise you get whitening until you're 18 usually.
Okay. Let's talk about I see it's like trendy now. And somebody, I made a post one time on social media. Somebody, wrote something that go and whiten your teeth. I'm like, where is
judgmental.
where is this one coming from? I don't understand. My video on my page and all of that, and everybody's tilting towards getting the veneers because then your teeth is more arranged, it's looking white and all of that. What are the effects, side effects, and the benefits of getting veneers? Is it necessary?
I always say that anything cosmetic is a choice. It is I want to. It's not compulsory. You don't need to. If it makes you feel good, no problem. Make sure it is a qualified dentist that is getting it done, and they are factoring in your oral dimensions, because some people get veneers done and they can't bite anymore. They can't chew very well. There's pain everywhere. Some people cut more than is necessary from the tooth surface to add on, because you can't just get and stick on like nails. You have to shave off some vital elements of the teeth to attach these things to usually. So make sure that it is a qualified dentist that is seeing you and getting these things done. But it's a choice. I like to say that.
Can you take it out?
Natural, if you take it out, you've lost a lot of your teeth in the process. With veneers is less than crowns, but in the end it's still not as whole as what you have now. We have to take off at least 2 millimeters of your enamel to get it on. Like 1.5, 2 millimeters sometimes, depending on
when it goes off, what you have is one tiny thing.
That's usually crowns. That's for usually crowns, where we take on a large process, and you usually just have like little pegs hanging out from your teeth. So usually it's a one-way traffic. Once you get it, you just have to continue on. Yeah,
please, I like about remedies, because in this world, coming to professionals can be very expensive. Please, can you tell us some of our lifestyle modifications? What are the things that we could eat? Maybe I should be drinking Zobo, or I should be drinking Tiger Nut. What are the things that we can eat that would help our oral hygiene organically?
So every food that God has made is phenomenal. Vegetables, fruits do wonders for our teeth. With children, we like to say, if they can, get them breastfed, because it helps their jaws to expand. Anything that contains vitamin C, vitamin D is excellent. Calcium, so your milk, your cheese, dairy products, and fruits, vegetables that contain these products are important. Then you can go also to dairy, fruits, vegetables usually has that. Then there's not a lot of research to back up, but I know that cloves, ginger, some of all those products also help with oral health.
I was going to ask about chewing sticks.
Yeah.
Because with chewing sticks, you don't really rinse. You just chew and then you spit out our forefathers, our ancestors used them. And I don't think they really had problems. And I think there are some chewing sticks that are actually really good, like the peppery one.
Yes.
What would you say about chewing sticks as a...
I believe that they are excellent choices, but we don't have enough research. I know one of my professors in dentistry did a research on this idiata or something. It's called something ata or something, and it was proven to have bactericidal effects in the oral mucosa. Yes, but how many people are planting these trees? Where do we find them? So those are the issues.
It's not just any stick.
Yes, it's not just any stick. We need to invest in researching our own homegrown solutions. The Chinese have done excellently well in that. We need to look into
our farm.
Yes, we need to look into our own natural grown products that help, because the truth is there's a lot of natural remedies that can help with oral health. Yes.
Okay, at what point would you advise someone should get braces? Because kids, they think it's cool and all their friends are having braces, but how effective are braces, and at what point do you think we should start considering braces for kids?
Okay, so once there's malocclusion, that's your teeth are not aligned in the area where your maxillary upper teeth are a little bit ahead of your lower teeth, then many times you need to get braces. So if your teeth are biting edge to edge, you have your teeth that flare out, there's large spaces, there's crowding, they're layering upon one another, there's you can't speak well because of the way your teeth are arranged, we advise you to get braces. They are super effective in correcting malocclusions. And the truth is, especially in teenagers, we don't realize how linked your oral dentition, your dentition is affect your self-esteem. And many times you see a 360 from children that get braces, where they were shy, timid, afraid to talk, and then they get braces and just looks like a new child has been born.
How long will the braces
usually we say between 12 and 18 months usually for braces. But there are also aligners that last for a shorter period.
So I felt like, because I used to suck when I was small, and I had that
open bite.
But because I consciously always covered it, arranged itself by itself. I didn't have to use braces. So sometimes I think that when I think about how I looked when I was my dentition when I was as a teenager and now, it's sort of self-corrected. Is it possible for you to self-correct?
In very few cases, very rarely. And the truth is, with thumb sucking, it lifts up the palate, and then it presses down the maxillary, the mandibular teeth, that's the lower teeth. And so many times the teeth don't close together. There's just we call it an open bite. So it is very rare that it will self-correct in some cases, but usually you need external help of braces and aligners.
I mean, for me at 63, I just feel that all these braces and this child needs braces. It's all just dentist 419. Let me say why I say so.
Yeah.
Because I felt I needed braces as a child. My father will braces. Go on. He will promise you forever. You will not get braces. My brother's teeth are crooked. No braces. Madia's teeth are crooked down here. No braces. All my brother's new children, all of them, braces. I say, you are spoiling these children.
You want to
Yes,
like that? No.
No, because we didn't get braces, and we are still alive.
That's not the point.
And we are still alive and kicking.
Your time is different. Your time was different.
So is the dentists, they are just enjoying. The money of braces is not small. It's like 1 million or something.
Oh, over that.
It's even more, you hear?
Yeah.
Oh, really? For braces?
Yes.
Are you kidding me?
Yes, over 1 million.
I went to check. My daughter needs. I was going to bring my daughter.
Yeah.
So it's over 1 million.
But we usually have installmental payment plans. So you can
spread
see
over.
period.
They can wait for 2-3 years, and then you will be paying that 1 million long.
Cleaning. So I saw someone
paid like one amount that you pay installment.
Well, every time you have to go to the dentist to go and check, they will say, I know,
I saw someone
something.
eating that has braces, eating vegetables, and then it just looked really bad because they were like
Stuck everywhere.
It wasn't nice at all.
We always advise there's some things that are not permitted to be eaten when you have braces on. There's some things we say it's best you eat them at home just for the aesthetics, and then you rinse out immediately. You brush your teeth.
Let's talk about the brushing at night, because a lot of people watching right now, we've talked before on this show, people don't brush at night because they feel like, well, there's no big deal. Tell us again the importance of brushing twice a day.
Okay, so the simplest way I like to explain is that over the day you have eaten all sorts, and you have, just imagine on this table we pour in rice, beans, potatoes, everything, and then we never wipe off the table. We just leave it. Overnight there's a lot that happens, much more than during the day. During the day you are speaking, you're talking, you're coughing, different things, but at night the mouth is closed and there's just a lot of bacterial activity, the normal bacteria that you have in your mouth. And so when you leave this food there over the night, they act on them, they break the sugars down into sugar acids, and that's when holes develop. So to break that cycle of these organisms breaking down food into sugar acids, just brush, you break the cycle, and then you wake up with cleaner, fresher breath.
So please let me just ask, since we spoke about veneers and all of that, those ones that put grill on their teeth, those gold, diamonds, those grills that they wear, what's it like? Is it safe? Is it good?
It's cosmetic also. I usually advise people, don't bother. These people are stars, they wear it on for a show and they take it off, no problem. But you don't want to have an external body in your mouth for so long, and then there's so much dirt, different things hiding in there. It's not safe. So you wear it once for an event or a photo shoot, you take it off, that's fine, but nothing permanent. And even braces that are we put them there, there's so much that we do to prevent food packing and to prevent caries from developing. So why add this on to yourself when there's no need for it?
Is it painful?
Which one?
Braces?
No, it's not. It's just the initial, just like wearing new shoes. For the first few days, you might feel that discomfort of, I have something new in my mouth, but usually you catch up. We have young children wearing braces. Have you worn braces before? No, I haven't, but we get them onto children, adults, grandmas, and it's the same.
So let's talk about the cost of oral health, because people are always worried that all this teeth matter is Oyinbo matters, because they are fine. Their father never used the dentist, they never needed to, so it's just too much extra cost. What is the cost like? Because I'm hearing now that braces is 1 million. Interestingly, next week, because they're on holiday, they're going on Christmas and on the Easter holiday. I was going to bring her to you because we're waiting to come to you. I might not bring her.
No, you'll bring her.
I find you. I was thinking of going somewhere else.
We'll find
so tell us about the cost of dental health.
So I like to say that dental health is not expensive, but when you wait till there's a problem, that's when there's an issue. As a child, it was recommended that I wore braces, but my mom kept taking me for regular checks, and they would just adjust this, use a temporary solution here, and it corrected naturally. But if you wait till a child is 16, they've never seen a dentist, they come in with holes, we have to do extractions, we have to do braces, and then it compounds. And so we just like to say, get dental care done regularly, every 6 months, and you can prevent a lot. So prevention is cheaper in dentistry than cure. It's cheaper.
I will try and make a point of going every 6 months.
Yes, ma'am.
All right, so we have to wrap up with you, but then because since we are celebrating World Oral Day, just give us a final message out there to Nigerians who are watching you today concerning oral health.
I like to say that your teeth are alive. They're not just appendages. They are connected to blood vessels, nerves, important vessels. And so please take care of your teeth. Visit a dentist every 6 months. Your toothbrush is not enough. It's just the beginning. And so visit a dentist to live optimally and have great oral health.
Sorry, I have one question. I noticed that one of my toothbrush, I have a travel toothbrush.
Yes.
So when I travel, I realized that toothbrush, the paste stayed underneath. Can that be dangerous when you leave paste?
Yes.
I had to throw it away eventually, but I didn't even realize it. So so people have their toothpaste and they leave the paste underneath the brush, the bristles, and they think it's okay.
How often do you change your brushes?
Every 3 months. Okay. And sometimes if you have like a cold, you've taken antibiotics, you've had a disease condition, just change it right after, because your oral microbes have changed in that period.
You can drop it in hot water and salt.
No.
If the toothpaste build up in less